The digestive system has 6 primary phases or functions. Ingestion or eating is the process of taking foods and liquids into the mouth. Secretion is the release of about 7 liters of water, acid, buffers, and enzymes each day into the lumen, that is the interior space of the tract. Mixing, the smooth muscle in the walls of the gastrointestinal tract due to motility. That is the process in which take place contractions and relaxations to mix the food with the secretions and drive them toward the anus. Digestion is the process in which food breaks down into smaller molecules for the body to take them into the cells and use them to perform its functions. Digestion has 2 phases. Mechanical digestion is when the food is grinded and mixed with digestive enzymes by teeth, tongue, and the intestines. And then in chemical digestion, with the aid of these digestive enzymes that are secreted by the salivary glands, tongue, stomach, pancreas, and small intestine, the nutrients in food as carbohydrates, proteins, and lipids are split into smaller molecules by hydrolysis. Some substance doesn't need to chemical digestion to be absorbed, such as vitamins, ions, cholesterol, and water. Absorption. This phase is given by the epithelial tissue that the gastrointestinal tract has, and that allows the entrance of the previously digested substances into the blood or lymph to circulate to cells through the body. And finally, defecation. That is the process in which all the waste, indigestible substances, bacteria, and digested materials that weren't absorbed are eliminated through the anus as feces. To delve further in the digestion process, we need to know its activities, and that these occur in 3 overlapping phases: cephalic phase, gastric phase, and intestinal phase. The cephalic phase is when salivary and gastric glands release their secretions to prepare the mouth and the stomach to receive the food. In other words, is when we think about food and we start to salivate. The gastric phase starts with the presence of food in the stomach and causes gastric juice secretion and gastric motility. And then intestinal phase takes place, when food is digested in the small intestine. In this part, the mass of food is called chyme, and for not to overload the small intestine with it, gastric motility and secretion decrease. Through all the process of digestion, digestive enzymes have an important role, because these are the responsibles of the very process, by splitting the nutrients in smaller molecules. Enzymes are proteins that speed up specific chemical reactions. The principal nutrients in food are carbohydrates, proteins, and lipids or fats. For example, starch is a carbohydrate, and its digestion starts in the mouth, with its conversion to maltose, that it's a smaller molecule of carbohydrates. This conversion is given by salivary amylase. As the intestine cannot absorb maltose, its brush border secretes an enzyme called maltase to convert maltose to glucose, a simpler molecule that can be absorbed. Finally, pancreatic enzymes such as pancreatic amylase and lactase complete the digestion of the remaining molecules of carbohydrates. Protein digestion starts in stomach with the gastric juice. This one is secreted by gastric glands and has a pH of 1 or 2 because it contains hydrochloric acid, who converts pepsinogen to pepsin, an enzyme that converts proteins into peptides, that are smaller molecules. These are chains of amino acids, and then the brush border secretes peptides and other enzymes to convert these chains into individual amino acids to get absorbed. Finally, pancreatic enzymes such as trypsin end the digestion of the remaining molecules of protein. And then we have lipid digestion, in which is essential the neutralization of the acid in chyme by the basic pH of the pancreatic juice, for the correct operation of pancreatic enzymes. One of these is lipase, that converts triglycerides, one type of fat, in fatty acids, once bile salts, secreted by the gallbladder, has emulsified them in the duodenum. The lack of any of the enzymes could cause illness. The most common is the deficiency of lactase, which leads to lactose intolerance, or in other words, diarrhea, gas, and cramps caused by the fermentation of non-digested lactose present in milk and derivatives. Another gastrointestinal disease is gastritis, that is an inflammation, irritation, or erosion of the epithelial tissue of the stomach. This can be caused by alcohol use, chronic vomiting, stress, use of medications as aspirin or anti-inflammatory drugs, a bacterium called Helicobacter pylori, pernicious anemia in which the vitamin B12 is unabsorbed, bile reflux, another infection caused by bacteria or viruses. If the gastritis is left untreated, it can lead to severe blood loss by the ulcers and can increase the risk of stomach cancer. That is why it's important to recognize the most common symptoms, such as nausea, abdominal bloating, abdominal pain, a burning sensation, hiccup, loss of appetite, vomiting blood, and black stools. Although many people have no symptoms, it's important that if one of those appear, to go visit your doctor to make a correct diagnosis. The main tests to detect gastritis are upper endoscopy, that consists in a tube with a tiny camera to check the stomach lining and take a biopsy. Blood test, to determine if you have anemia or any bacteria. And fecal occult blood test, for checking the presence of blood in the stool. The treatment depends on the cause. For example, if it's anemia, vitamin B12 shots will be given. If it's a bacterium, then antibiotics will be prescribed. But always the treatment includes taking antacids and eliminate hot, spicy, and irritating foods.